Hello, dear students and esteemed learners. Welcome in the fifth lecture of our course on Sociology of Health. The topic that I have included for this lecture is Health and Disease, Indicators and Sociocultural Determinants. And in this topic, I've covered the health indicators and the sociocultural determinants of health and disease. I've also included some of the biological determinants so that we can differentiate between the biological and the socio-cultural determinants, but the focus will be on the socio-cultural determinants of health. Now we will begin with health indicators. A health indicator is a variable that can be measured directly to reflect the state of health of people within a community. A health indicator or health indicators are required for multiple purposes. So basically, health indicators are the popular terms that we frequently use whenever we talk about health or for that matter, development. One very important health indicator like life expectancy. Everybody is talking about that. That has become an important indicator of development, not only in terms of health, but the overall health, or for that matter, infant mortality, etc. That means you and we all are familiar with the health indicators, but I'm talking about the indicators here so that we should have a fair understanding about a good number of indicators that we are making use of. Health indicators are required for multiple purposes, like to measure the health status of a community. If we want to know about health status of India, then how can we know without making use of the indicators? So we will need good number of indicators so that we can understand the health status of our country. Or if you want to make comparison between two or more states of our country, then again we will need health indicators. Then if we want to make an assessment of the healthcare needs of the people, because people are in need of certain health facilities, so how can we get to know about that? Right? So for that purpose also we need health indicators. And then for allocation of the resources, the financial as well as the human resources. For example, if there is one health program about to be launched, so which states need how much resource allocation, that will be decided on the basis of the prevailing health condition in those states, and we will get to know about the prevailing health condition only by understanding the health indicators of those states, right? So these are very important, and basically our sociology of health is very helpful in understanding these indicators in a specific context, because there are actually different groups within the same political entity. So if we can understand, if we can calculate the health indicators for various groups, then it will be very helpful in understanding the positioning of the groups. And we all know that sociology is a study of social groups, as we have discussed in the first lecture also. And we are basically focusing on understanding and explaining that. So if there are health differences existing among different segments of population or different sections of the population on the basis of multiple identities, then basically these indicators could be very helpful in understanding that. So the first most popular health indicator is expectation of life or life expectancy. We talked about this in the previous lecture also. Expectation of life refers to average expected life of an individual at the time of his or her birth. When expected life of an individual is long, it reflects a good state of health and control over morbidity conditions and vice versa. That means long life expectancy is an indication of more developed state, and poor or lesser life expectancy is an indication of lesser development. So life expectancy is very important. In 2023, the average life expectancy for those born in more developed countries was 75 years for men and 82 years for women. On the other hand, the respective numbers for men and women born in the least developed countries were 63 and 67. Now, I've taken these figures and these are very important. I don't know why this is not functioning. Anyway, now we can understand what these figures are actually saying. First, there is a difference between the developed countries and the least developed countries. That is very obvious. Along with that, there is a difference between men and women also. And we can see that the women are having more life expectancy than men. And that shows basically the relative positioning of men and women in terms of health index. So if you are aware of this difference in the life expectancy of males and females, and then if you see the composition of population, or for that matter the sex ratio, then you will get to know so many contradictions existing in any society. So these indicators will help you to understand the society more comprehensively. The life expectancy of females in India is 71.1 years and life expectancy of males in India is 68.4 years. And these figures were calculated on the basis of the data available for the period 2015 and 19. Now, one thing you need to remember that these indicators are basically based on certain numbers, and actually the calculation may vary by one agency. One agency may calculate it in a different way by making use of one base year, and another agency may calculate it by making use of data or by taking data from another year. So sometimes basically these figures may vary, but I'm basically making use of these figures here so that you can get a practical understanding of what we are talking about. Then there are basically different types of indicators. Some of the indicators are actually identified as mortality related indicators or mortality indicators. And mortality is basically referring to the death process characterizing a population. So when some death is taking place, we say that this is a case of mortality. Mortality basically refers to death at a larger or the collective level, right? That means the societal level. The study of mortality examines the relationship between death and the size, composition, and distribution of the population. Right? That is why I stated that at the societal level, because the size, composition, and distribution of the population is important. Mortality is calculated for the entire population. We will not calculate mortality for one individual or for a very small group, but for a larger group, because that is basically calculated on the basis of the larger prevalence. Now, there are different types of mortality indicators like the crude death rate, the CDR. It is defined as the number of deaths per 1000 population per year in a given community. It indicates the rate at which people are dying. In India, it was 9.45 deaths per 1000 inhabitants in 2021. Again, these figures will vary, right? So please excuse me if you happen to find these figures a little differently after Googling that, because I'm telling you that these numbers may vary from one source to another source, because everybody is making use of certain data set. Then we come to very important form of mortality, that is child and infant mortality rate. We all talk about these indicators. Child mortality rate is defined as the number of deaths at ages 1 to 4 years in a given year per 1000 children in that age group. And then there are different indicators related to this child and infant mortality. We have this neonatal mortality rate. Neonatal refers to the child before reaching the age of 1 month, that is by less than 1 month. And then infant mortality rate, and here infant refers to the child not come before reaching the age of complete 1 year, and so it is referred as less than 1 year. And then under 5 mortality rate. This infant mortality rate, neonatal mortality rate, and under 5 mortality rate are very important indicators. Again, they are not only talking about prevalence of mortality among the children, rather they are actually indicating the approach of the state or the society towards their children. And don't forget that the children are the future of the nation. So if a particular society or a state is not taking care of the health of the children, that means the state or the society is not taking care of its own future. So these indicators are very important. Then we come to the next important indicator, that is maternal mortality. Maternal mortality is defined as the death of a woman during pregnancy or childbirth or in the 42 days after delivery from any cause that is related to or aggravated by the pregnancy. So this is maternal mortality, that means death of a woman either during pregnancy or childbirth or within 42 days after delivery, right? This part of the life is basically known as the maternal experience of the women, and so this mortality is basically identified as maternal mortality. It is calculated by using the indicator maternal mortality ratio, MMR. Maternal mortality in India continues to be a major concern given the reduced social, cultural, and economic status of Indian women that inhibits them from adequate access to health facilities. So, when we will make progress on various topics, we'll get to know that in India there are several typical health related issues and challenges, and most of these are often related to the women, and among those, the maternal mortality ratio and the issues related with the reproductive health are more important or very serious. So, here we have one indicator that shows us the status of health of women and status of women as such in the larger society. Maternal mortality ratio is very helpful in understanding these things. And one more thing I would like to add, that if you see the MDGs, that is the Millennium Development Goals, then they have categorically made use of many of these indicators. We will talk about MDG at some time in some lecture. Then there are morbidity indicators. Basically, what is morbidity? Morbidity is basically prevalence of sickness and disability within a population. So, historically, morbidity or the level of sickness and disability within a population has been an area of study for both clinicians and population oriented scientists such as epidemiologists. The morbidity rates which are used for assessing ill health in the community are, there are different morbidity rates like incidence and prevalence of a particular disease, as we discussed in the previous lecture, prevalence of communicable and non-communicable disease, then notification rate, then duration of stay in hospital, and spell of sickness or absence from work or school. All these things basically will indicate the kind of morbidity rate prevailing in that society. You can understand that if someone is remaining sick and unable to join work or unable to go to school, then this can be this data can be helpful in understanding the prevalence of morbidity among that particular age group or that particular work group. Then there are other indicators like nutritional status indicators. We talked about it in the previous lecture also. So there are many nutritional status indicators, but I have mentioned here 4. One is anemia, known to all of us. Then height for age, weight for weight for height, and weight for age. Let me briefly make you understand. Basically, when the age is increasing or growing and the height is not increasing, then this is known as stunting. When the height is increasing and the weight is not increasing, this is known as wasting. And when the age is increasing but the weight is not increasing, this is known as underweight. All these situations basically indicate malnutrition. So, nutrition or malnutrition related indicators are big indicator. If a society is witnessing malnutrition at a massive level, then certainly it's not having good health and it is bound to have multiple problems in terms of morbidity and disease. So these are very important indicators. And then finally, we can talk about certain healthcare delivery indicators. In every society, there are healthcare delivery agencies, healthcare facilities, and on the basis of basically the number of personnel or professional involved there, we find out certain ratio or indicators like doctor population ratio. That is, what is the number of doctors per 10,000 population, or for that matter per 1,000 population, per 20,000 population. So that is an indication of the kind of health facility which is existing in that particular society. Just like that, the doctor and nurse ratio, because very often we have doctors but we do not have the paramedical staff, and we all know that for healthcare the nursing or the paramedical staff are equally important, right? Then population bed ratio, where people will become sick, they will need to go to the hospital. So whether there are hospital beds or not, we all have seen that during COVID there was a serious issue related to availability of hospital beds also. So these are all indicator of basically the kind of healthcare facility which is available in a particular society. Then we come to the determinants of health and disease. So in the previous lecture also, when we were talking about disease, we have discussed few uh, agents which are responsible for causation of disease. So you can relate this part with that part also, but here you will get to know many other important things. Many factors combine to affect the health of individuals and communities. Whether people are healthy or not is determined by their circumstances and environment. The context of people's life determine their health, and so blaming individuals for having poor health or crediting them for good health is inappropriate. So this statement uh, sometimes could be challenged, because of course lots of personal effort is required for making or improving one's health, but basically those efforts are only one part of the story. The circumstances in which those efforts are made, or those the circumstances in which those efforts become possible, is again the larger part of the story. So here we'll talk about the larger story in terms of the determinants. Like, so there are biological determinants like genetics. Inheritance plays a part in determining lifespan, healthiness, and the likelihood of developing certain disease or immunity. Race, ethnicity, caste, kinship, family, etc., often considered to be associated with the biological origin of people, and thus these are important determinants of health as well as disease. So we all are even aware of the role of genetics in causation of certain disease. Then age and gender. Yes, we all know that men are different from women, or women are different from men in certain physiological structure, and then of course many social attributes, right? And because of that, very often they have a little different lifestyle also. That means this biological difference is creating lots of social differences also, and that is why the sex becomes a very important determinant of the health and disease condition. And then there is one very important thing that we all understand: women have the crucial reproductive health issues, right? So women, because of the reproductive role, do have certain issues, problems, and challenges. Then there are biological agents and environment. We talked about the biological agents in the previous lecture also. So we can relate that yes, there are biological determinants. But going beyond the biological determinants, we have the socio-cultural determinants. And here I would like to focus on these socio-cultural determinants. For example, income and social status. That is playing a very important role. We have seen the data, right? In at several places when we were talking about prevalence of communicable and non-communicable disease at a global level, at all India level, we have seen that the prevalence of disease is related to the income of the people or the level of income of the country. So income is a very important determinant. Higher income and social status are linked to better health. The greater the gap between the richest and the poorest people, the greater the difference in health. Poverty creates serious handicaps in the path of good health, and you can relate the figures that we have seen before with these statements. Then employment and working condition. If income is very important, then the source of basically that income is employment. That means employment is again a very important social determinant. And then the working condition, because employment is basically prevailing in different forms. In India, for that matter, we have the organized sector and the unorganized sector. So the work condition in the unorganized sector is not very good, rather very poor, very different from the organized sector, right? In most of the cases, in certain situations, things may be different, but in most of the cases, that means income, then employment, then work condition, and then the social status, all are playing very important role in terms of determinants of health as well as disease. And then the work environment and pollution, we all are aware of basically how pollution is creating serious health threats. And if the work environment is not free from that pollution, then it is also basically playing a very critical role there. Then comes the very important individual attributes like education. Yes, we all know education plays very important role in developing a good attitude, appropriate mental conditioning, appropriate knowledge and awareness, and appropriate health awareness. So the benefits of education is visible at multiple layers in terms of achieving good health or not having good health. And education of the mother is considered very important for the health of the children. And then if we see it from the perspective of reproductive health and maternal mortality and then infant mortality, then education of the women is becoming very important. So any society which is not having very good education for the women is bound to have poor health condition of the women of that particular society. Then comes lifestyle. We have already talked about lifestyle at many places, and I think you all are well aware of the kind of impact that lifestyle is creating in the overall health and disease scenario. Then comes a very important point here, the social support network. See, social support is very important, not only for physical health, but also for mental health and social health. And we have seen that WHO, that is World Health Organization, is talking about social dimensions of health. So, this social support system is playing very important role. And then there are very important sociological concepts like social capital and cultural capital. This social capital is playing very important in having access to certain facilities which are very necessary often in terms of healthcare. So social capital and cultural capital play very important role in determining the health status of people. And then we come towards the end of this lecture. Health activities, basically availability, accessibility, acceptability, and affordability of the health services and other related and other related determinants of health that prevent occurrence of disease and treat disease are also important determinants. See, health services need to be available, not only available but also accessible, and there should be acceptance by people also. Having that health facility will not be beneficial unless people have acceptance for that. And then comes the financial part, that is affordability. So a health system which is basically fulfilling all these desirable conditions, then it will become very good for the health of the people. Then comes the public health system. Public health is again a very big topic, very there are so many dimensions included in this, but nutrition and food security is one dimension, water and sanitation is another important dimension, then occupational health and disaster management is another important part, and then road safety and accidents. So we have been talking about these points at some or the other place, and I think that you have a fair understanding about these things. So what kind of public health system is existing in that particular state will determine the health condition of that particular state. If the public health system is doing very well, then the health condition will be very good. And then last but not the least, basically the governance, the political governance and the nature of the society, basically the civil society, the kind of engagement that people have with the various political institutions, that basically indicates the level of participation of people, and participation is one of the very important processes to ensure good health, right? So the overall political environment and the nature of the society, and especially the civil society, is also playing very important role in terms of deciding the health status of that particular society. And so these are also very important socio-cultural determinants. So we talked about many determinants in today's lecture, and we will keep on talking about those determinants, because this course on sociology of health is all about understanding those socio-cultural determinants and the factors which also get influenced by these socio-cultural determinants. So with this I close this lecture. Here is the references and recommended readings, and here is the think about this and activity question. So please take care of these things, and we will meet in the next week with a new topic, new theme. So till then, take care and have a great day. Bye.